There are many reasons why you could be tired. I'm going to run through a few of them now. Just skip the bits where you know they don't apply to you. Let's go. What is your quality of sleep like? Adults need between 7 and 9 hours of quality sleep per night. Just because you're lying there for this time doesn't mean it's good quality, containing enough deep restorative sleep and REM, which is rapid eye movement sleep. You should wake up feeling refreshed. A smartwatch or app on your phone can be useful, but don't get bogged down with the data. Go by how you feel the next morning. Are you struggling to get to sleep in the first place? Some of the culprits are stimulants like coffee, using your phone before bed, the bedroom's too warm or cold, etc. Check these things out. Do you have anxious thoughts before bed? White noise can be a help in getting to sleep, or some ASMR, meditation, sleep hypnosis, or reading. Are you waking through the night? Try and cut your fluids before bed, a few hours before bed if need, in the toilet through the night. Are the noises that are waking you up? Is your mattress and your pillow comfy enough? Alcohol is a terrible, terrible thing for your sleep. It disrupts the cycle. It's bad for you in general and won't help your anxiety or your energy levels. Do you have sleep apnea? Some signs of this would be snoring, dry mouth and throat, choking or gasping sensation, or a disturbed sleep. So get this checked out. Could your diet be to blame? You really are what you eat. A terrible diet can make you feel just that. Terrible. Low mood, no energy, foggy brain, anxiety, joint and muscle aches, etc. Cut down on processed and inflammatory foods and sugar. Drink plenty of fluids. Water is best. Even being slightly dehydrated can make you feel very tired. A balanced meal with all vitamins and minerals. Too many carbs can make you feel tired and sleepy. Eat mostly vegetables and protein during the day. Save your high-carb meals for nighttime and you'll sleep like a baby, I promise. Could it be a lifestyle? You need to move your body if you're not doing so already. Exercise actually boosts energy levels. There are several reasons for this. Exerting your body produces more mitochondrial cells inside your muscles. These are little energy factories, so having more of them increases your body's energy supply. Also, an increase in oxygen during exercise allows your body to function better, and the hormones produced give you a boost too. So both short-term and long-term gains to be had. Exercise also promotes better sleep. Win-win. Also better mood, weight, long-term health. You will live longer. So although it may not be directly causing you to feel tired, it is highly recommended to help many, many issues. Sleep, diet and exercise are the three main pillars of health. So if you figure these out, you are winning at life, trust me. Recommended is 150 minutes of aerobic activity weekly. Medical conditions that can cause tiredness. This is where I would recommend seeing a doctor. If you have everything figured out so far, I would recommend blood tests, especially if tiredness isn't your only symptom. Let's look at some of the common issues and their corresponding symptoms. So first we have anemia. This is a condition where you have fewer red blood cells than normal or less hemoglobin. This is needed to transport oxygen around the body. This can cause many symptoms, some of them quite serious. Some of the symptoms you may experience are things like tinnitus, which is a ringing in the ears, fatigue, weakness, pale skin. You can have cold hands and feet. Your heartbeat can be irregular. We can have some shortness of breath, dizziness. Pica is unusual cravings for things that aren't really food or dirt. There can be many reasons why you might have anemia. Some of them are listed on the screen there. Excessive blood loss is one of the reasons. So, for example, if you have very heavy periods, pregnancy, and a poor diet especially, you're not getting enough vitamin B12, folic acid, and iron, this can be a cause as well. So as mentioned, you could be iron deficient or deficient in vitamins such as folate and vitamin B12. A blood test will determine the type you have and the corrective treatment will be advised. For example, you may need vitamin B12 injections or iron tablets. Try and eat a balanced diet rich in all these things. I've popped some examples on the screen there if you just want to pause it and have a look. Next, we have hypothyroidism. I've popped some examples on the screen there of symptoms. Have a look and see if any apply to you. This is a decrease in production of the thyroid hormones from the thyroid gland. Thyroxine regulates many bodily functions, including metabolism, growth and energy expenditure. Some risk factors are things like family history, increase in age, autoimmune diseases like Crohn's. Some medications can actually cause hypothyroidism as well, like antipsychotics. And if you aren't getting enough iodine in your diet, that can be a factor as well. Treatment is by taking a daily hormone replacement tablet called levothyroxine, which is just taken once a day in the morning. I think everybody knows what diabetes is, so I won't go into detail. The symptoms you may experience are fatigue, frequent urination, excessive thirst, frequent infections, numbness and tingling, dry skin, and slow healing. This is due to the excess glucose in the bloodstream. It's causing all these issues. If you have any of these symptoms, especially if there's a family history or you're overweight, please consult your GP. The health outcomes of untreated diabetes can be devastating to your body and your health. Type 2 can be controlled with lifestyle. The type 1 requires insulin injections. Now, menopause isn't really a medical condition, it's more of a result of aging, but I'm going to discuss it here. Going back to the start, menopause can really affect your sleep. It can affect many things, even if you are in perimenopause, which occurs before menopause at the ages in the 40s, roughly, average 47, where estrogen levels start to drop. Can be as early as 40s to 50s, it's very variable. The symptoms would include things like irregular menstrual cycle, often becoming heavier and more painful, mood swings, tiredness, hot flashes and night sweats, breast tenderness, memory fog, problems concentrating and memory retention, vaginal dryness and discomfort, aches and pains everywhere. See your GP. You may be offered a blood test to rule out other causes and to discuss HRT or hormone replacement therapy if that is what you choose and if it's appropriate for you as well. Some people choose not to. You may just want to go without or explore other options. There's no right or wrong, just which option you feel is right for you. Let's look at some mental health issues now that can cause general tiredness and fatigue. Depression can come on gradually and may be difficult to notice. Look at some of those symptoms and seek help if you recognise them in yourself. A decrease in energy levels, just feeling tired, difficulty sleeping, mood changes, just feeling very sad or empty or worthless, anger, irritability, no confidence, no interest or pleasure in activities, gaining weight, dark thoughts, especially of harming oneself, and avoiding contact with your friends and your loved ones. No blood tests are usually required, just speak to someone. If not your GP, then a trusted family member or friend, or join a local support group. Stress is a huge cause in exhaustion and fatigue and tiredness because there's an increase in cortisol levels which can leave you feeling just exhausted. Some symptoms are things like fatigue, you can't sleep, no energy, chronic pain, sweating, being jumpy all the time, you're in constant fight or flight mode, changes in libido, tension headaches, muscle tension everywhere, irregular or rapid heartbeat, chest pain, digestive issues. There are many self-help techniques out there, including meditation, journaling, cognitive behavioural therapy, breathing exercises. Seek advice from your GP. Some other causes are self-explanatory, such as bereavement, the new baby, massive stresses such as divorce or moving house. You would know the cause of your tiredness in this case. We assume you wouldn't be watching a video called Why Am I Horse Tired? Let's look at medication now. Remember, the medication you may be taking can have side effects such as tiredness and fatigue. This is generally on initiating treatment. Then your body gradually adapts, but not always. Some allergy medicines, such as antihistamines like chlorphenamine and diphenhydramine, generally if taken short-term can cause drowsiness and fatigue. Opiates like codeine usually will get better after a few days, but you will feel tired and drowsy after each dose increase. Anxiety meds like benzodiazepines and diazepam, these can cause drowsiness and fatigue. Antidepressants as well. And some blood pressure medications as well, like ACE inhibitors, beta blockers, like atenolol. These slow the heart rate, making you feel more tired and dizzy. This should wear off, but if it doesn't, you may need to change to a different type or decrease your dose. The list is quite endless, honestly, but my advice is to check with your GP or pharmacist if you are taking medication regularly, especially if you'd been on them for longer than about 4 weeks. You may need to be switched to something else. Or maybe none of this applies to you and you're just like me I'm always tired. I take on too much. I work too many hours. Long commute to work. Single parent. Trying to start a YouTube channel. It's just all a bit much sometimes. Just try and take some time for yourself when you can. Thank you.